Hello, my name is Mr. Prashant Purohit. I'm a consultant in Gynaecology, Fertility and Reproductive Medicine here at the London Pregnancy Clinic. Today I would like to talk to you about a very important baseline fertility test, and it's called as a HyCoSy, which stands for Hysterosalpingo Contrast Sonography, or sometimes called as HyCoSy. At the London Pregnancy Clinic, we strive to be the largest and most specialized provider of HyCoSy scans in London. A HyCoSy test is a fertility test used to assess whether the fallopian tubes are open or blocked. This test plays a very crucial role in evaluating your reproductive health, particularly the fallopian tubes on each side, which is essential for natural conception. They are responsible for capturing the egg released from the ovary on one side and providing a path for the sperm to meet the egg for fertilization. Tubal blockage is a cause of self-fertility for 1 in every 3 to 4 couples or individuals. Tubal blockage may be caused by scarring, often secondary to infection, endometriosis, or any previous surgery. By doing this HyCoSy test, we can identify all these blockages and recommend appropriate next step in your fertility journey. It's recommended for couples who are undergoing routine baseline fertility investigations, or for those who are preparing for fertility treatments like ovulation induction or an intrauterine insemination. This procedure also will include a normal baseline scan looking at your uterus and 3D scan, as well as the ovaries doing a follicle count. A HyCoSy is usually a quick and well-tolerated procedure. It doesn't require sedation, and importantly, there's no radiation involved like the traditional X-ray test called as HSG or Hysterosalpingogram. Instead, we use ultrasound imaging, which is completely safe and provides you with clear, live detailed pictures during the procedure. During the procedure, I usually would perform a speculum examination, just like your smear test, to introduce a very small tube called as a catheter through your cervix into the uterus. Then a small amount of dye or the foam is then introduced through the catheter into the uterus. A transvaginal ultrasound is then performed simultaneously to confirm that the dye is then flowing through your fallopian tubes via your uterus. The dye usually shows up as a very bright white line on an ultrasound as it travels through the fallopian tubes, and then we can conclude whether the tubes are open or blocked. Before the HyCoSy, it's important that you're well prepared. We'll provide you with an information sheet that outlines what to expect during the procedure and after the procedure. We'll typically prescribe antibiotics to reduce your risk of infection and ask you to take some painkillers. The procedure is very well tolerated, and most patients experience only mild discomfort or a little bit of bleeding during and after the procedure. HyCoSy is a valuable tool in fertility diagnostics. By checking the fallopian tubes, it provides us with critical information that helps us guide your fertility journey. Whether you're trying to conceive naturally or are preparing for assisted conception, this test can make a significant difference in your treatment. If you think a HyCoSy test is right for you, or if you've been struggling to conceive and are looking for answers, please don't hesitate and reach out to us at the London Pregnancy Clinic. We are here to provide you with expert support and individualized care you need to achieve your goals of starting a family.